All right. The second disease that we have to learn is also developmental or neurodevelopmental, okay? And it's called Arnold Chiari Malformation 1, okay? And if it is named 1, we expect that there is also 2, right? So in this case, we're going to talk about Arnold Chiari Malformation 1. And what happens here, now we actually have this congenital downward displacement of cerebellar tonsils and the medulla through the foramen magnum. But in this case, it is not life-threatening. Isn't medicine beautiful? You think you know something, and then you get hit by a new fact that actually a little bit changes the thought process, right? Why is it not life-threatening? Because during the development, this foramen magnum is not stiff, right? It's still developing. So if you are pushed through that foramen magnum before it closed and became that hard structure, you actually make space for it, okay? That's what happens in Arnold Chiari malformation, where both medulla and the tonsils are displaced downwards through the foramen magnum. It's not life-threatening because foramen magnum was actually expanded because of that situation, because of the congenital malformation, right? And what is also characteristic that this displacement of the two, okay, through the foramen magnum is associated with a cavity. So there's a kind of a hole, right, inside the spinal cord, right, that is called syrinx. Okay, so these are the two main characteristics of Arnold Chiari malformation. So if the question is, what is characterizing Arnold Chiari developmental malformation, you will say displacement of the cerebellar tonsils and medulla through foramen magnum during development, and syrinx, the opening or cystic cavity within the middle portion of the spinal cord where that central canal is. All right. The number 2, okay, the Arnold Chiari malformation 2 and how it is different, right, from Arnold Chiari malformation 1. You have a downward displacement of more structures of the cerebellum, not only tonsils, but also cerebellar vermis and tonsils and medulla. So basically just vermis is also kind of so to speak draining through the foramen magnum, in developing process, okay? So what happens, because now there is a little bit compression on this flow of cerebrospinal fluid, we will get this hydrocephalus again that we saw in Walker Dandy, right? So basically accumulation of CSF inside the fourth ventricle and third ventricle that will become bigger, okay? And because of this kind of hydrocephalus, they'll also increase the intracranial pressure, right? We will learn in the visual system, why we actually have that papilledema, which means kind of bigger pupils, right, in the increased intracranial pressure. And there is also projectile vomiting in these patients. And that's because there is a center for vomiting in medulla. All right. And that center for vomiting in the medulla is also the center that gets triggered if somebody drinks too much alcohol, right? Because the most of the central nervous system is protected by, in this case, there is that area postrema, that is actually a sort of a chemo monitoring center, right, that is measuring if there are toxins in the body. And when this area postrema decides that there is too much of toxic things, it will induce vomiting, okay? And in this case, since it is again compressed, and because of compression is a little bit firing at higher rate, there will be some projectile vomiting in this patient, okay? So what else is being associated? You remember in Chiari 1, we have that syrinx in the spinal cord is associated with this hanging cerebellar tonsils through the and medulla through the foramen magnum. In this case, in Arnold Chiari malformation 2, we have something called lumbar meningomyelocele. Okay, very high yield. Okay, remember it now, today. This is the Friday, the March 1st, that you will remember lumbar meningomyelocele are associated with Arnold Chiari Malformation too. Okay, so what is that actually? What is lumbar meningomyelocele? Okay, so it is a developmental malformation of the vertebra's development and positioning of the spinal cord. Okay, and for the Chiari number 2, you have to focus all the way on the right on this spectrum of different malformations. Okay, and meningomyelocele is actually when the vertebra, right, is not closed completely, the bone that is holding the spinal cord inside, right? And particularly this transfer process of the vertebra, right, is opened, okay? And now, basically, this meninges together with the spinal cord are misplaced out of the vertebral canal, right, under the skin, okay? And that skin can be even absent. So basically, you can see the spinal cord protruding out of the back of the child, right? When they are born, if they have this lumbar meningomyelocele, you will order immediately the MRI to see if we are talking about Arnold Chiari malformation, where the vermis, tonsils, and medulla are protruding through the foramen magnum. Okay. Some other malformations, the most kind of, let's say, less severe, is the spina bifida occulta, where there is a small kind of opening in this vertebra. The spinal cord is still in place with the meninges, here shown in pink, right, surrounding the spinal cord. And then you have this, you see this? Like a patch of hair on the skin. It's very, very interesting phenotype, where spina bifida occulta with broken or not kind of closed, vertebra, and it has this patch of hair on the back, okay? The meningocele, okay, is the one that doesn't have the sort of the hair. It can have a little bit, but in most cases it doesn't, where the actually meninges are protruding out, but the spinal cord is still in place in vertebral canal. And for us, the most important one is meningomyelocele, where both the meninges of the spinal cord and spinal cord are displaced out of vertebral canal and positioned under the skin that can be very, very thin or absent. Okay.